John Matlin joined hundreds of anti-vaccine protesters in New York City, where the radiology tech's own hospital has imposed a staff vaccine mandate.
It started off as mandatory PCR testing for the unvaccinated, and I knew where that would lead.
Nearly 40% of U.S. hospital systems now require staff to be vaccinated, but most are still reluctant to push it.
There was concern that 10-20% of their workforce would potentially quit. And that was particularly true of talent that was really competitive. So nurses, for example, some AI programmers fall into that category.
In July, over 8% of healthcare jobs went unfilled, a record well above the national average. In nursing, it could get worse, according to a new survey from the American Association of Critical Care Nurses.
One of the things we're fighting for is simply truth.
92% of the nurses say that what we've endured during this pandemic has depleted the nurses at their hospital, and it will shorten their career.
Houston Methodist saw more than 100 workers resign following its mandate this summer. That didn't stop Memorial Hermann across town.
Because we have staffing shortages, need to keep our people working. We certainly don't want anybody to be at risk for developing severe illness.
With an October deadline looming, less than 24 workers have refused the shot so far out of 29,000.
We believe we can overcome those losses.
3/4 of critical care nurses support vaccine requirements.
People who are vulnerable come to us, and we need to be able to take care of them safely.
John Matlin is still fighting it.
The whole entire idea of New York City having a vaccination passport, now we're doing medical segregation.
Matlin has lost his job, but not for refusing the vaccine, according to his employer. Matlin believes it was due to his anti-vaccine activism at work. Shep?
Bertha, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.